Okay, everyone. So we will be going through some questions tonight, and I always like to put out my acknowledgement slide. Very important. And I also want to say that I'm not the original source of these questions, but they are all for teaching purposes. So we have the first question here. It says a pelvic exam on a woman is 12 weeks. So the buzzword is 12 weeks. Okay. 12 weeks pregnant will reveal that her uterus is located at which of the following area? So the first one said between the umbilicus and the suprapubic bone, just rising above the symphysis pubis, which is the suprapubic. So I think B is the answer. So if you get B, you are correct. So that is between the suprapubic bone and symphoid process. No, between the umbilicus and symphoid, these ones are higher. So it's just rising. It's just rising. So between the umbilicus and the suprapubic bone, that will be your 16 weeks. Okay, we continue. Okay, I will share my question again. So this is the next question. A nursing home resident reports to the physician that his roommate was recently started on tuberculosis treatment. A mantle test and chest x-ray are ordered for this person. So what is the minimum in duration? So this is asking you about a nursing home resident. So what will be the in duration for nursing home resident?
10.
Type in your answer. Type in your answer. So we said 10. So the answer is C. 15, we said that 15 is the general public. Then 5 is HIV, immune compromise. We don't have anything as 3. Which of the following is recommended treatment for erythema migraine? So what is the treatment for? First of all, what is erythema migraine, which is Lyme disease, right? So what do you think is the treatment? At least this one, they didn't give us the date of birth, the old age. So the answer is A, doxycycline. But remember, we mentioned you can type it for me. What are the other treatments? I mentioned 3 treatments. Type it. What are the other treatments? If you don't give doxycycline, what else do we give for erythema migraine? You give amoxicillin. And what is the last one? Amoxicillin. We have amoxicillin already. Erythema migraine. There is another one that starts with C. What is the treatment for erythema migraine? Outside amoxicillin. Wow, I thought that this one would be a giveaway. I typed the answer, cefuroxime. We did this just last week. I typed the answer, cefuroxime, CEFUROSIME. And I told you to use the acronym CAD, like card, CAD. Okay, so that is your cefuroxime. Then A is your amoxicillin. Then D is your doxycycline. You need to know those three medications, please. Very important. So use the acronym CAD. Cefuroxime. A is amoxicillin. D is doxycycline. Make sure you are using your Telegram so that I'll be seeing people that respond and people that don't respond. A common side effect of metformin. What is the common side effect? The CAD is, we said, is the acronym for treatment for Lyme disease, erythema migraine. So C means cefuroxime, CE. All this thing is in the Telegram. Go to your Telegram group. It's all there. Then A is your amoxicillin. Then D is your doxycycline. Please confirm you got that, CAD, okay? Then a common side effect of metformin therapy is, everybody got that, diarrhea. So the side effect for metformin, so you are looking at diarrhea, you are looking at flatulence, but there's no flatulence in this answer. So diarrhea and flatulence. Another thing is um, monitor the renal and the hepatic, okay? It doesn't cause any hypoglycemia. Remember that. It doesn't cause any hypoglycemia. It doesn't cause any weight gain. Then calf a lot of spots look like tan to light brown stain that have irregular border. They are located anywhere on the body. So which of the following is correct statement? So what did we say is the correct statement for calf a lot of spots? Type in your answer. A, they are associated. That is correct. Sometimes what you will hear is a hallmark of neurofibromatosis. So A is the answer. Hallmark of, sometimes they will not put it like associated. Yes, hallmark of neurofibromatosis. That is cafe alerted spot. Remember, it's in pediatrics. Cafe alerted spots. Did we get that? Type in yes or no. Yes. Okay. All of the following infections are reportable disease. So which of the following, all of them are reportable, except, you can always highlight it, except which one. Which one is not a reportable disease? Which one is not a reportable disease? C, right? That is correct. C. So Lyme disease is reportable. Gonorrhea is reportable. All the STDs are reportable. Meningitis is reportable too. So the only one that is not reportable is gonococcal uritis. Good. Take note of how many you were able to get. The cover and the uncover test is a screening test for cover and uncover test. Cover and uncover test is a screening test for cover and uncover test. It's a screening test. Cover and uncover test. That one is a giveaway question. Cover and uncover test is used for what? That is a simple question. Only one person. That is only one person. The answer is strabismus. Strabismus. Okay. Strabismus. Okay. Yes. Strabismus. The mother of a 4-year-old infant is concerned that her infant's eyes are crossed for a few seconds occasionally. The nurse practitioner will do what? So this child is the eye is crossed just a few seconds. The buzzword is few seconds. Yes, the answer is I tell the mother is normal. So the buzzword is a few seconds. If it's more than a few seconds, then that is now very bad. We call it a vertical because we have horizontal nystagmus and vertical nystagmus. So V for V. Vertical nystagmus is your what? That is your very bad. So that is your very bad. But horizontal one is just under two seconds. You know, initially, I'm glad that we are learning all these things because I remember when my daughter was doing this. Initially, I was worried, but I remember that it doesn't even last up to 2 seconds. Then I felt better. So sometimes, if it's lasting more than that, you are worried about brain issue. So that is why it's normal to have a horizontal one. The child will just do their eye, all of a sudden they cross start their eye and it goes back to normal. Okay. All of the following children are within the parameters of normal growth and development. So normal growth and development, 2 months old, who cools and smiles. Is that normal? Except 14 months who understand complex command, 20 months who walk without support, 3-old who speak in 3 to 4. I think it's B. Yeah, we are correct. B. That is too complex for that child. Okay. You are reviewing the bilirubin level of a 3 days old neonate. 3 days. You note that it is 10. The infant has a slight yellow color to the eye, mucous membrane, and sclera. The infant is feeding well, is not irritable, and has 8 to 10 wet diapers. So that is telling you that the child is doing well. Which of the following is true statement? Keep monitoring the infant's bilirubin until it returns to normal in about 1 week. Recommend that the infant start phototherapy. Refer to uh, neonatologist, refer to intensive care unit. This baby, you can see that this baby is doing well. So what do we do? Yes, keep monitoring the baby because this is just 10. Remember what we learned? We only concerned when it's 15. When it's at 15, that is when they start the phototherapy. But this is just 10. Okay? This is just 10. You suspect enterobiasis infection in a 6-year-old girl. So what test do we use? This one is a giveaway answer. Enterobiasis. What tests do we use? Enterobiasis. What test do we use for enterobiasis? First of all, what is enterobiasis? It will point you to something. So that is telling you about pinworm. Pinworm. So the answer is Scotch tape. The answer is Scotch tape. So that is your pinworm. Okay. A medium pitch harsh mid systolic. So once you hear systolic, that is your Mr. Pass. Systolic, Mr. Pass, MVP, is heard at the right second intercostal. So right second intercostal space of the chest. It's radiating to the neck. Okay, what is it? It's radiating to the, so Mr. MR pass. Oh, aortic stenosis. Thank you. Because sometimes I have to put down the acronym. A 19-year-old woman has recently been discharged with acute hepatitis B. She is sexually active and is monogamous, only one spouse or partner. She reports that her partner uses condom inconsistently. What would you recommend for her male sexual partner who was also tested for hepatitis with the following result? So if you look at this result, everything is negative. The hepatitis antigen is negative. So then the antibody against hepatitis is negative. Then the surface one is negative. The only one that is positive is the anti-HAV. So what do you recommend? So what is that telling you? So hepatitis vaccination, hepatitis immunoglobulin, okay. Hepatitis B vaccination and immunoglobulin, no vaccination. So what is this indicating? D, D, B. So is this indicating hepatitis B vaccination? So that means this patient have past or present infection with hepatitis A, so or vaccination. So this person have some kind of vaccination. So that is what it means. The person have some kind of vaccination. So the person have some kind of vaccination. That is what it means. Which of the following? So I will choose A. They have some kind of vaccination because that is what gave them that antibody. Which of the following condition is associated with positive auspic sign? That is simple. Positive auspic sign. Where do we have positive auspic sign?
D.
Psoriasis.
D.
Psoriasis. Please type in your answer in the chat. Type your answer in the chat or type it in the Telegram. Okay, everybody is correct. D. Psoriasis. So remember, in psoriasis, we have auspic sign, we have Koebner phenomenon, and we say that psoriasis is the silvery plague. Okay. Which of the following is used to confirm a diagnosis of Hashimoto? So what do we use to confirm a Hashimoto thyroiditis? Is that what we use? What did we say about what did we call it again? Yes, we call it TPO, right? Yeah, that is it, TPO. They say to confirm, to confirm. So that is what we use to confirm. So if you are choosing TS, you are wrong. To confirm definite diagnosis, we call it TPO. So that is anti-thyroid peroxidase. I have said this so many times. So please take note if you didn't get that. That is C. Okay. The best screening test for both hyperthyroidism and hypo, that is B. So this is the screening test. So what people get confusing here, screening is different from confirmation. If you want to confirm, then you do the TPO. But if you want to screening test, because you can screen for something, for example, you can screen somebody for like you do my fasting blood sugar. It's very high. It doesn't mean that I'm diabetic, maybe because I ate something or, but if you really want to confirm, then that is why we said you need to do 2 to 3 tests. Then you can do A1C, you do fasting blood sugar, you can do random, or you can do the 2 hour. You cannot just use one thing. So that is what it's telling you. To confirm something is different from screening. So that is your TSH for screening. But for confirmation is TPO. Please pay attention. Okay. During the routine physical examination of a 90-year-old woman, a low pitch diastolic. So once you hear diastolic, what acronym are you remembering? Miss Always Right. Diastolic, Miss Always Right. Okay. It is located at the fifth. So MS, Miss Always Right, right? Did we get it? Miss Always Right. Diastolic, Miss MS. Why are we not getting it right? That is mitral stenosis. Miss Always Right. That is the acronym.
Please. Is that
This
the
is this is a giveaway question.
doctor?
So the answer is Miss mitral stenosis. So I don't know how many people that got it. Okay. Couple of people got the answer B. Which of the following is considered an abnormal result on Weber? So what is abnormal for Weber? Lateralizes to one ear, no lateralization, air conduction, bone conduction. So
Mm-mm,
what is this?
mm-mm.
Please mute yourself. This is Weber. I'm surprised we're not getting this. Remember, Weber has to do with lateralization only. Renin is the one that will be A conduction greater than B bone conduction. So C and D is out. C and D is out. The answer will be B, no lateralization. The answer will be B, no lateralization.
Hmm.
No lateralization. Hmm.
Yeah, but first of all,
This
so
is
abnormal
supposed to.
result though.
So that will be A, he lateralizes because the buzzword is abnormal. Abnormal. Sorry about that. Abnormal. Okay. A neighbor has a 14-year-old son who is active in basketball, complains of pain and swelling on both knees. On physical exam, there is a tenderness over the tibial tuberosity of both knees. So what do we call this? Your answer, this should be a giveaway. Please remember to mute yourself. That is Osgood scatter disease. Osgood scatter disease. So that or Osgood Schlatter, whatever you call it. During a sports physical exam, a 16-year-old patient is noted to have a few bits of horizontal nystagmus on extreme lateral gaze that disappear when the eyes move back towards the midline. Which statement best describes this clinical finding? I think I just explained this. So nobody should fail that. I finish explaining it. Let's see. The answer is B. This is a normal finding. Yes. If it's vertical, I remember it as V, very bad, vertical. So horizontal is normal, and you see that little children, they keep doing that. I think they do it for fun. But if it's vertical, then it's possible brain problem. A new infant who is small for gestational age is noted to have a short, oh, this is simple, shortened palpebral features, microcephaly with small jaw. What is that? And I gave you the acronym the last time. So that is your alcohol, right? Fetal alcohol syndrome. Good. Please take note of how many you scored. You're testing yourself. The most common cause of cancer death in women in United States is what? Put your answer. Most common cause cancer. That is long. Thank you. But if they say the number one cause of death, it doesn't matter the age. Number one cause of death, that is heart disease. But if they say number one cause of cancer death for women, for men, is lung cancer. A middle-aged nurse complained of localized pain. This is simple. On the sole of her feet, left foot, between the third and the fourth metatarsal. You can hear my voice. The pain is aggravated by weight bearing and feels like pebble in my shoe. During the physical examination, the nurse practitioner palpates a tender nodule in the metatarsal interspace on the left knee. Foot. The redness, we already have the answer. Or swelling is noted. Which of the following? That is your Morton neuroma. Okay. I felt like I'm standing on a pebble in the third and the fourth metatarsal. You will always see the buzzword. Okay. So that is Morton neuroma, and the test we use is MORDA test. And 18-year-old female is being followed by up for acne for the nurse practitioner during facial exam. Look at the buzzword, purple and pustules. Purple and pustules. I've said this repeatedly. Noted on the forehead and the chin area. The patient had been using over-the-counter topical antibiotics gel and medicated soap daily for 6 months without much improvement. Which of the following will you do now? So what will you do? Are you going to give Accutane? Are you going to give tetracycline? Okay. This one is a giveaway. Tetracycline. Okay. The most common type of skin malignancy in United States is what? The most common. Squamous cell carcinoma, basal cell carcinoma, melanoma. Yes. B is the answer. Basal cell carcinoma. And at this point, you should be able to differentiate malignant melanoma, which is the one we said A, B, C, D. Or we said it's asymmetrical border, irregular border, color, different color, diameter greater than 6 millimeter. So anytime you are doing any of these questions, also look at the options. Okay. Also look at the options and try to learn. Okay. Then another question here is which cranial nerve innervates the extraocular muscles of the eye? Which cranial nerve? Is that not simple? So that is the cranial nerve 3, 4, and 6. So what is 3, 4, and 6? That is 3, 4. That is B. That is B. Okay. Which of the following tests would you recommend to a patient to confirm the diagnosis of beta thalassemia? The answer is looking at you. What do we use for thalassemia? Sickle cell iron deficiency. That is hemoglobin electrophoresis. Good job. So proud of all of you. All of the following patients have an increased risk of developing adverse effects from metformin, except so. All these people can develop adverse effects from metformin, except which patient? Except C, obese patient. Except obese patient. The treatment plan of patients with AIDS who have CD4 count of less than 200. So when we say they have a TB4 count of less than CD4 count of less than 200, that means they have AIDS, right? So what would be your plan of treatment? Will you administer MMR vaccine, which is live vaccine? Will you do preventive therapy of toxoplasmosis? Will you do preventive therapy for PCP? Do you remember what is PCP? I'm glad you guys remember PCP. PCP. Okay. So that is the pneumonia we were talking about, PCP. And we said that we start them on Bactrim. Okay. We start them on Bactrim. So that is your they used to call it pneumocystic pneumonia, but you know they changed the name to pneumojurovic pneumonia. So they call it PJP now, but it used to be PCP. So it's still correct. Somebody that don't know what is PCP will miss that. It used to be PCP, but now it is PJP. Okay. If a female patient complains of dizziness when he moves her head, you suspect benign paroxysmal positional vertigo. The diagnosis is supported by the presence of. So how will you do a diagnosis of vertigo? BPPV. What is that? So how do you do it? B, right? Horizontal nystagmus with rapid head movement. Yeah. Tinnitus is your Meniere's disease. Which of the following conditions are possible cause of secondary hypertension? This question is asking you secondary cause of the major cause of secondary hypertension. Oh, do we have, did you say Hashimoto? What of renal stenosis, myocardial infarction, leukemia? Which one are we choosing? So I will choose, I don't know what you are choosing, but I will choose C. I will choose C. That is the renal artery stenosis. Okay. Balanitis is caused by what? We know it's caused by candida, but it's called, oh, I said the answer. Oh, no. Balanitis is caused by candida albicans. Okay. And you remember the acronym DUI. At this point, you should be summarizing your study. DUI. So if you see anything, you remember drug, uncircumcised, immunocompromised. That is the risk factor, DUI, for balanitis. Drug, uncircumcised, immunocompromised. Then another question, 16-year-old complained of a severe sore throat for 3 days, along with a generalized rash and fever. The skin have a texture of fine sandpaper. Yeah, DUI. DUI is diabetes, immunocompromised, uncircumcised. That is the risk for balanitis. All of them is in the slide. 16-year-old complained of severe sore throat for 3 days with generalized rash. So we are talking about sandpaper rash. Why are we choosing the wrong answer? Sandpaper rash. Sandpaper rash. That is your scarlatina. Scarlatina. That is the only place you have sandpaper rash. Scarlatina. Thank you. Kawasaki disease is that they will tell you that the skin is peeling. The skin is peeling. Okay, look at that question that comes all the time. A college freshman who is using oral contraceptive called the nurse practitioner office asking for advice. She forgot to take her pill 2 days in a row during the second week of the pill cycle and wants to know what to do. So what do you tell her? She forgot to take her pill 2 days. So if we have said this so many times, what will you tell her to do? Do you tell her to start a new pack of pills and dispose the old one? Take 2 pills today, 2 pills tomorrow, and have your partner, that is the answer. B is the answer. And have your partner use condom for the rest of the cycle. So it's like telling the patient to double dose. Take 2 pills today, take 2 pills tomorrow, then continue to use another form of birth control. A 13-year-old boy wants to be treated for his acne. He has a large number of, did you see what I'm saying? Closed and open comedones. So where do we have closed and open comedones? So that is telling you something. They didn't call the name for you, but they said closed and open comedones. The patient had been treating himself with over-the-counter benzoperoxide and topical salicylic acid products. Which of the following will you recommend? The answer, retinine A. Thank you. So proud of you guys. The rumba test is done to check the problem with balance. Which area of the brain? Yeah, I've been looking for this question. The answer is cerebrum. Thank you. So don't forget that rumba test check for problem with balance. The area of the brain is responsible for balances the cerebellum. An older man is diagnosed with conductive hearing loss in the left ear. Pay attention, left ear, by the nurse practitioner. Which of the following is expected result when performing a renin test on this patient? So the left ear is the problem. What will happen in renin, not Weber? I don't want to hear any lateralization. This is renin. So not Weber. Don't do anything lateralization. So C, BC will be greater than AC. Right? Yes, that is correct. C. I'm glad you guys are getting this Weber and this thing running. A 15-month-old who is eating and behaving normal is found to have a high fever. After a few days, we just talked about this, the fever resolves and the child breaks out with a maculopapular rash. This is a description of what? The fever resolve. Remember we said it? That is roseola infantum. Infantum. Even if you do elimination method, A and C is the same. That is fifth disease. B is roseola infantum. It's also known as sixth disease. That is the one, but the fifth disease is the same as retima infectiosum, infection. So anytime you hear about infection, don't confuse it with infantum. Infantum is a small child. Infectiosum is infection. So that is the one we said to hand over the baby, the child to the spouse, because it can cause fetal demise in the first and second trimester. High risk of fetal demise. Which of the following is recommended treatment for essential tremor? Recommended as the first line. Two answers there is type in your answer, please. Type in your answer. The answer is, you see that all of them, dilantin is correct, propanolol is correct, but they said the first line. So that is A, propanolol. Okay. A 60-year-old. Let me leave you read this, it's too long. So what are we going to do for this patient? A, order MRI. Okay. You are not referring yet because you need to know what is going on. I think MRI is the diagnostic test. So order MRI as soon as possible. You can do MRI start. Worsening low back pain. And you know that low back pain, maybe the test that we use is the straight leg test. What is the significance of a positive Lachman sign? Simple. Lachman, we have explained Lachman. We have three tests. One is draw sign and Lachman. Lachman will check for knee instability. So positive one, instability of the knee. Thank you. Okay. You see how they try to confuse somebody here. If you look at this B option, posterior cruciate ligament, which is still Lachman, but they now said it causes locking of the knee. This is now this is not different. This ending part is wrong. Locking of the knee, that is your valgum. Valgum. So somebody might say, oh, but we also check for posterior cruciate ligament. Yes, we do that, but half of the question is wrong. So when you have half part of the question as wrong, is a wrong answer. So because I was looking at it, I said, posterior cruciate ligament PCL, anterior cruciate ligament, they are all talking about Lachman. But the only difference is says it may cause locking of the knee. That is wrong. The one that causes locking of the knee is our what? That is our valgum. And that is the one we said is our medial collateral ligament. Which of the following pharmacological agent is the best choice for elderly patients? So what will you give the elderly patient best who has insomnia? What will you give for insomnia? We give for insomnia, that is Ambien. That is Ambien. We can't give Valium. Valium has a very long half-life. It's Ambien. What is the best description of cooling sign? Remember the cooling sign? U in the middle to remember umbilical area. So let's see the one that have umbilical area, C. Simple, C, right? Then the one that is on the flank area, we call it a great turning, okay? Which of the following is a precursor lesion of squamous cell carcinoma? Nobody should miss this one. Oh, let me check. Oh, please, please don't miss it. That is D. So proud of you guys because sometimes it's that easy. Did somebody miss it? Somebody
That was a
T.
mistake.
Okay, D. Actinic keratosis. Okay. A positive Schwartz and obturator sign is suggestive of which condition? This one is simple. MacBook Pro. MacBook Pro. The acronym MacBook Pro. Okay, appendicitis is the answer, right? The mother of a 12-month infant reported to the nurse practitioner that her child have a high fever for several days, which spontaneously, we just did this, which spontaneously resolved. After it resolved, there is a rash. So that is your word, roseola infantum. We did it. So sometimes some answers can be come back again. What is the most common type of cancer in young children? Remember L for little. I said something about L for little. L for little. So which one has L for little? Little children. That is acute lymphoblastic leukemia. Thank you. I believe some of you are hearing my voice. At what level is the uterine fundus at 12 weeks? Is another repeat. At 12 weeks. That is where? At 12 weeks. At the site of symphysis pubis, A. So B is your 16 weeks, symphysis pubis and umbilicus. At the level of the umbilicus, 20 weeks. Okay. What is expected result of renin test in patient who has serious serous otitis media of the left ear? So renin, ringing, so left ear is still a repeat. So that is B. Which of the following is used for the diagnosis of vaginal trichomonas? What will you use for vaginal trichomonas? Whiff test? It can't be whiff test. Whiff test is for BV. Whiff test is for BV. Remember, whiff. I told you that bacterial vaginosis is 3F. Whiff test fish smell, flagell. What do we use for vaginal trichomonas? Vaginal trichomonas or trichomonas, sorry. What do we use? The answer is C. C. Wet smell. Where we use KOH. KOH is the same. KOH is the same as bacteria. It's the same as bacterial vaginosis. So if you do elimination method, A and B is out because whiff test is bacterial vaginosis. KOH is bacterial vaginosis, including candida. So this is a wet smell. All of the following symptoms are associated with irritable bowel syndrome except irritable bowel syndrome, except mucus with stool, diarrhea or constipation, diarrhea with mixture of blood. Yes. No, they said except is except. When it's now with mixture of blood, then that is ulcerative colitis. That is ulcerative colitis. Yeah. But
Oh,
if the
we're looking at
normal finding is diarrhea mixed with constipation, they'll have diarrhea today,
sorry.
tomorrow they have
I think
constipation.
I was answering
So
699.
it's diarrhea with blood. That is, it says signs are associated except. So that is except. The A is your ulcerative colitis. Then this one is simple. A 8-month-old girl brought in by the grandmother to see the nurse practitioner because of intermittent random episode of vomiting, abdominal bloating, current jelly stool, and with poor irritability with poor appetite. The infant is trending in the 10th percentile on the growth chart and appears lethargic. During the abdominal exam, a sausage-like mass into success. Let me make sure nobody said that one. I won't believe that. Yes, into succession. A positive anterior draw sign. Anterior draw sign, that is your ACL. It's indicative of what? That is, remember the buzzword anterior. If they say posterior, A, B, and C, they are still Lackman. But the only thing is that they are specific. They said anterior. So that is C. Then A is your meniscal tear, which is McMurray and Apley. Then D is the one we talked about as the lock knee, which is your medial collateral ligament, valgum. And that is it, my people. Let me. Okay, so we already know this one. Olive-like mass, olive-like shaped mass. That is pyrolic stenosis. And adolescent came in for sports physical. He has pectus carinatum. So this was what I keep saying about a Marfan syndrome. So Marfan syndrome, they have a heart issue. So this is one of the heart issue they can mention to you, and it's all there in the video. When we mention the signs and symptoms that patients that have a Marfan syndrome. So this they have this pectus carinatum. So it looks like the rib and the breastbone, it grows outward. It grows outward. There's another word they use to explain that, but just know that it's one of the things you see in Marfan syndrome. Okay, so remember, although I know they will have like other things like like heart issues. So that petus, the word they call it is a pigeon chest. So pigeon chest. Okay, remember that is in the video. Marfan syndrome, they have those heart issues, and one of the issue is a pectus carinatum, and that is your pigeon. That is the pigeon chest. Okay, or pigeon chest. So P for P. They can ask you where you have pigeon, Pigon, Pigon, pigeon chest. Okay. And Marfan syndrome is associated with what condition? Mitral valve prolapse. We remember Marfan syndrome, mitral valve prolapse. And what do we have in mitral valve prolapse? We have we have S2 click. S2 click. What do we give to a 6 months old infant? We give them iron fortified cereal. Iron fortified cereal. So you need to read up pageant developmental stage. Is in one of the crash courses, but read it up. So in adolescent, because you have different stages, so they're asking you in adolescent, that will be formal. So this is one of the ones maybe you guys can go through it when we log off, when I log off, pageant developmental stage, and you will see every stage. They can ask you any of those stages. So for the adolescent, we have formal. So we 2 to 3, 2 to 4, no, 2 years, 0 to 2 years is sensorimotor. That is what they have. And there, I believe there's an acronym, but you can always form one. But something about they have a, I think it's SPCF, sensoromotor, pre-operational, concrete, and formal. Okay, so please read up that pageant developmental stage because they can ask you any of these stages. So at least these four: sensoromotor, sensoromotor, pre-operational, concrete, and formal. Sexually active teenager, what test do you request? So this is that wet mouth. So it's not KOH. Remember, KOH, we said is for Candida, is for BV. Okay, so you need to know where we use the wet mount. These are the things you need to be summarizing with. Where do we use wet mount? Okay, then you'll be able to come up with the wet mount slide. So those conditions, and you need to know that. Okay, so very important. And another one, 13-year-old is asking you for sports clearance. What is the least important information? That is nutrition. That is the least. 2-year-old baby with severe jaundice. The following are checked. Yes, severe jaundice. You check the comb test, the bilirubin, the ABO, which is the rhesus. The only one that is not checked is the urobilinogen. Mm, okay. You have a 16-year-old patient went on camping. Patient went on camping, and patient weight has a weight loss of 10, nocturia, polyuria, polyphasia, polydipsia. So you can see that this patient have you can say type 1 diabetes. So we're going to start them on insulin. So we have a 8-year-old. They have uh, the breast sometimes hot, but otherwise symmetrical. So it's normal. One breast is somehow bigger than the other breast in children until they grow. Female who is underweight and still exercise. So this is talking about anorexia nervosa. So this patient is underweight. So what are other signs and symptoms of anorexia nervosa? Lanugo, weight loss. They will keep trying to lose weight when they are still skinny. Another one is menstruation. They have problem with their menstruation. A 4-month-old infant comes in for scheduled immunization. The mother claims that her son has water diarrhea but febrile. What is your plan? So patient mother claim that the son have water diarrhea. So what do we do? He says still give the scheduled immunization. That because this is just saying that it's not an allergic issue, so the child can still get it. He's saying give a Tdap. We are not giving Tdap at 4 months. What is we give is DTaP. A pediatric patient with drooling, the buzzword is drooling, will not eat. Where do we have drooling? Epiglottitis. Remember drooling and what else? Drooling and difficulty swallowing. And what do we have in the X-ray? We will have a thumb sign. Thumb sign. Patient is on Ritalin for ADHD with hematocrit 28. What will you monitor? Anytime they are on Ritalin, monitor the height and weight. Also, if blood pressure is here, blood pressure, because this medication is called Schedule 2. Schedule 2. If blood pressure is here, you should also monitor blood pressure. Okay. Most likely cause of conjunctivitis for 4-year-old, that is gonococcal. That is the one they inherit from the mother. So, and he gave you the rationale. Less than 24 hours is chemical. Then within 74 hours, 2 to 4 days is gonorrhea. Then 7 to is chlamydia. Then anything other than 14 days is herpes. So when does the child triple their birth weight? They triple it at 1 year. What is the most likely cause of hyperbilirubin in newborn baby? Remember, they have cephalohematoma or caput suspendum. Those two, that is the birth injury. Okay. Most common cause of diarrhea in children is rotavirus. Rotavirus. Most common cause of diarrhea. Signs of child abuse in 3 years old patient except retinal damage, cigarette burn, vaginitis, except bruises on the shin. Bruises on the shin will signify they fell. Okay, take note of this. Signs of fetal alcohol syndrome. So that is that smooth filtrum. So remember, they don't have a high set ears, it's low. So also remember the acronym SIT, SILT, for alcohol syndrome. So just read up the whole alcohol syndrome, just the symptoms.
Did you say C? Oh, C.
SILT, SILT, is all in this thing. SILT. This it will it's under pediatrics, the video. The following are high risk of gestational diabetes except family history of the only thing is maternal age greater than 25. What is the best time to check women for gestational diabetes? 24 to 28 weeks. Okay. What is the ideal A1C value? 6.5. The following is true about hyperemesis gravidalum. That is the one they vomit and vomit and vomit, except mostly limited um, first time pregnancy. That is not true. Level of HCG runs parallel with occurrence of, okay, may give visceral, occurs any time of the day. So I think A is the answer. Mostly limited. It's not just first pregnancy. The following is true. Yes, except so the one that is wrong is A. Mostly limited in the first time pregnancy. It can happen in any pregnancy. It's not just in the first pregnancy. Okay. The following is true about mastitis except observed for 2 weeks. So you can, it's most common in 3 months, in the first 3 months. Remember, that is when they have breast engorgement. Okay, mastitis generally occur in lactation is true. Several weeks postpartum is true. So not observed for 2 weeks. So what is the following are treatment for mastitis except, so remember our KCD. We use Keflex, which is cefalexin, clindamycin, and dicloxacillin, which is this. So augmentin is also your amoxicillin. So the only one is Bactrim. We don't use Bactrim. We don't use Bactrim. Female patient with 2 centimeter mass on mammography. What is the appropriate diagnostic test? That is ultrasound. Okay. Patient is
So, sorry,
bleeding
Pastor.
after
Sorry, Pastor. So after mammogram is when there's positive mammogram, then we go for ultrasound. Like
ultrasound. Yes, that is the sequence.
mammogram, ultrasound.
Patient with vaginal bleeding after 1 year of menorrhea, that is endometrial cancer. So patients that have gone through menopause should never bleed. If they have any form of bleeding, then that is they should not be able to see any blood after menopause. Patient with vaginal spotting after menopause, so that is endometrial biopsy to rule out endometrial cancer. The following is true of bacterial vaginosis, presence of clue cells. Is true. Okay. They have, somebody will go and choose A. A is positive. Positive positive whiff test, not negative. And the first line of treatment is your flagyl. Okay, and flagyl, you need to avoid alcohol to prevent antibus reaction. Okay, so what is the symptom of recurrence herpes? That is the painful. It's painful, and if they keep having the herpes, it will lead to um what is that again? It will lead to those three prodrome: hepatic neuralgia, which is your itching, burning, and pain. Itching, tingling, itching, burning, and tingling. Itching, burning, itching, and tingling. Now I remember
Is there no
the
numbness?
acronym is beat, burning, tingling, and itching. Numbness,
So it's burning, itching, and
burning,
tingling.
beat, B-I-T.
PIT. That's the three program, right?
Yes. Coliosma is a pregnancy mask. It's a pregnancy mask. A woman is being treated for trichomonas. Which of the following you should give? Avoid alcohol because they are on flagyl. So avoid alcohol. So that is what it means. Okay. A 13-year-old with breast mass, which of the following is correct? It's exogenous obesity with a breast mass. So which of the following is correct? You can read up that. Patient 34 years old, AG, AOG came in because of vaginal bleeding and abdominal pain. So vaginal bleeding and pain. So when they have vaginal bleeding and pain, remember with pain, that will be placenta abruption. So the AOG is age of gestation, 34 weeks of age of gestation, and patient have abdominal pain. If they don't have a pain, then that is a previa. But for the part they have pain, that is a brochure. Female with infertility, hirsutism, and acne and obesity. That is PCOS. Simple. PCOS. Infertility, hirsutism, and we said that the medication we give them spirolactone to help with their hirsutism, and the reason for the hirsutism is the excessive male androgen, excess androgen. Pregnant patient with fundal height midway between umbilicus and symphysis pubic. That is 16 weeks. We have said this so many times, 16 weeks. Fundal height just above. That is 12 weeks, just above. Condylarma acuminata, that is a cauliflower-like growth, not in the ear. The one that is in the ear is cholesteatoma. And they can also ask you the strange that is more associated with cancer, that is 16 and 18. 16 and 18 is more associated with cancer, 6 and 11 is more for condyloma acuminata.
Same as vaginal warts, right?
Mm-hmm. So patient that will have among the following is an adverse reaction. What is the adverse reaction for oral contraceptive? It will cause high BP, leg pain, varicosity, except it's a high HDL. High HDL is a good thing. Bad one is a low HDL. You want high HDL, not low. The one that you don't want to be high is LDL. LDL is the bad one. A 65-year-old woman was diagnosed with atrophic vaginitis. So what will be the treatment? Atrophic vaginitis. The answer will be, it's supposed to be, I don't know if they mean lubricant. It's supposed to be lubricant. It's not hormonal replacement. This is atrophic vaginitis. It should be a lubricant. Patient is breastfeeding and wants to use over-the-counter pills, oral contraceptive. What do you give them? Mini pills. Okay, mini pills. The following is not a risk factor for osteoporosis. If you remember what we said, Asian lady, Caucasian, they are all risk factor. But Hispanic, another thing you remember about Hispanic are, sorry that I am saying it, but Hispanic are more fat or big, something like that. They are not skinny. So that is another way to remember. So you have your risk factors. Read up your risk factor. We have said it. We have the treatment, vitamin D, calcium. So patient is 30 weeks the gestational age of gestation is complaining of pain. So, what drug of choice? So, what drug will you give to a patient that is? You see how you know if something is wrong. The last stage of pregnancy, first line,
Kick the baby out.
last stage of pregnancy, you want to kick the baby out. Then, what is the drug of choice? We don't give Bactrim in pregnancy. We don't give levofloxacin. We don't give Cipro. But the problem we have is that this question is avoidance, avoidance. We don't give, so I think uh, all these questions here, all these medications here are wrong. But the only thing is, I will say A. You know why I will say A? This is why sometimes we have to be careful and read in between the line.
3 days. Mm.
Another one don't come. But anyway, looking at this answer, 4 of them are wrong. But let me arrive at the answer. We don't use levofloxacin and ciprofloxacin. They are respiratory quinolones. We don't use it in pregnancy because of Achilles tendon rupture. Okay. But we don't even use microdentin too. Microdentin is your nitrofurantoin. We don't use it in 30 weeks because we said it's increased risk of bilirubin. So the only one that is correct I will use is Bactrim. Even though we said that Bactrim is not safe in pregnancy, but what researchers said is that it should not be used after 32 weeks. But what we have here is 30 weeks. So, and it's only for 3 days. So questions like this, all of them is not right. But for you to choose something, because there may be questions like this, you are like, what is these people saying? The only best option will be Bactrim because levofloxacin and ciprofloxacin, they are the same thing. If you remember, they are all respiratory quinolones. So you are left with macrodentin and Bactrim. I wanted to go for macrodentin. Then I remember that the macrodentin, we don't use it in 3rd trimester because of hyperbilirubin. And hyperbilirubin is still not good for the child because it can mess up with their what? With their brain. Okay, it can lead to mental retardation. So the only thing is Bactrim. Some authors recommended not to use it after 32 weeks, but you can still, and this is only for 3 days. So I don't think 3 days will do any much harm. So these are the instances of exception. Remember, we said we don't use doxycycline in pregnancy, if you remember. But when it comes to Rocky Mountain spotted fever, it's an exception, then we are using it because what the research is saying is that you are going to weigh the benefit from the harm. So it's going to cause more harm if that person is not treated properly. And I believe it because I once shared I have a patient have cellulitis, and I know for sure for cellulitis we're going to treat the patient with BCD, Bactrim, clindamycin, um, doxycycline. But unfortunately, this patient is allergic to Bactrim, she's allergic to clindamycin, and the only one that she can get, which is doxycycline, she is on blood thinner, which is Coumadin. And that was when I had to reach out to the primary doctor, and the primary doctor gave augmentin. But after 1 week or seven, I believe it's 7 days, it's still super red. My mind is already telling me, I know that the best bet would have been augmentin, but to be honest, I'm not a researcher. I may be wrong, but I will, from my own, whatever I'm saying is from my own brain. Don't quote me anywhere. I said, and I was talking with the patient. I said, tell me, what allergy did you really have? Or what, I was trying to really understand. I said, you can see the augmentin didn't do much for you. The redness is still getting worse. And that was now when the patient told me, he said, you know what? At this point, anything that will help me, I'm ready to try. And I said that is why sometimes we look at the benefit and the harm. And I said, yes, I know you are in blood thinner. Doxycycline can affect your coumadin, but the doctor can always go around it. It's either the dosage is adjusted, you know, and I explained everything. Funny enough, she ended up in the ER because the woman was so scared she's going to lose her leg and all that. And let me tell you, at the ER, she gave them all her history and everything. They still prescribed doxycycline for her. And she came back, she was so happy and said, it was the same medication you were saying. And it's just for 7 days. She took it. If you see her leg, it looked like 70%. So sometimes these antibiotics, no matter what you do, and if you look at the benefit and the risk, just 7 days, the highest thing is that we know that with Coumadin, it can lead to bleeding or something. She doesn't have any sign of bleeding. So the only thing is educate the patient, oh, this medication can do this, but please, if you see any sign of bleeding, then we have to stop. So that is what I'm trying to say in this question. Yes, we don't give bathroom. I agree with you. Somebody may try to argue. But researchers went further to say we don't, at least not after 32 weeks, you cannot. So I think they purposely put it 30 weeks to test your intelligence. So because you cannot give macrobate on the thought. So this question is hard, but believe me, it's you will come in contact with questions like that where it looks like everything is right or wrong. Then we have, when do you screen cervical cancer? That is, we start at pap smear, age 21. Most common form of momo in pregnancy. What is the most common form of momo?
Sorry.
Systolic ejection momo. Please pay attention. We said that no pregnant, we shouldn't even hear diastolic momo in a pregnant woman. Refer them. This is a common one in the exam. Most common risk, most common risk in cervical cancer is a multiple sex pressure pattern. That one is simple. So this is your ASCUS US. We have said it so many times. Look at those chart again. All these ones, ASCUS US, um, high, high and low squamous intraepithelial lesion. So know that chart. Know that chart. There's no way you need to know when. So you can have two questions on that, depending on what you are asked. So, for example, you have a 27-year-old who came into the 27. Remember 21 to 24. So this patient came in and patient have ASCUS US. So look at your calendar again or the table again. So, but I will just go with the answer and move on. Repeat the pap smear after 6 months because this is not good. So look at it again. Patient is 27. Patient is not up to 30. I believe it's 30 or 31. Look at the chart again. That should have been colposcopy. But look at it, the age. Then we have, oh, look at this one. Ascus high. High. H is a bad one. Ascus high. I use H for high. The same thing I said about HSL. High, anything high is the bad one. So I don't want to repeat anything. Look at all the option. I don't want to repeat anything. I will just go straight to colposcopy because it's high H. So I use the H. This is how I remember my own. But that chart, look at that chart again. So the chart, this there's two questions here. One is ASCUS US, another is ASCUS high. What is the most common risk factor for ectopic pregnancy? That is tubal salpingitis. Yes, and tubal salpingitis it will lead to ectopic pregnancy. The following is true about placenta previa, except hypertonic uterus. Yeah, concealed hemorrhage presenting as abdominal pain. So all these things, and I put this on the Facebook, is hypertonic uterus. So all these three is all correct. They have abdominal pain, they have concealed hemorrhage, they have hypertonic, because I put it and some people were choosing placenta previa. No, hypertonic uterus. First trimester bleeding, no, it doesn't happen in first trimester. The one that will happen in first trimester, that will be ectopic pregnancy. Ectopic pregnancy, or but not ambrosial placenta is usually at the last stage of pregnancy. Most important prenatal screening, that is HIV. Very important. And we say that once it is positive, they will start them on the once the woman, you confirm that the woman is HIV positive, you start her immediately on retroviral medication. But if it's the baby, you can start her on 6 to 8 hours. I saw another um, information saying 6 to 12 hours, so it's still correct. So anything between 6 to 8 hours, 6 to 12 hours, depending on what you see for the baby.
Pastor, can I ask a question?
Okay. So, pregnant woman with neuropathy, what advice will you give her? Tell her that most neuropathies, which is true, resolve after pregnancy. A 68-year-old patient has history of breast cancer. Upon follow-up on your clinic, now patient has abdominal pain and pelvic. So what will you do for this patient? So you need to order vaginal ultrasound and cancer 125. Okay. Pregnant woman with carpal tunnel syndrome, tell them most neuropathy will resolve at the end of the pregnancy. Risk factor for breast cancer, age. We have other risk factor. Oh, this one is very common in the exam. What is the most common factor in ovarian cancer? Family history. 20-year-old who is 14 weeks pregnant, complaining of vomiting for 8 days. What do you need to assess? So this is 14 weeks. Patient is vomiting. So why is this person vomiting? So check for urine for ketone. 80 years old has a vaginal bleeding. The same thing we are going over and over again. Vaginal bleeding. endometrial biopsy. Which of the following needs referral in a pregnant woman? Generalized abdominal pain. That is not good though. Generalized abdominal pain. Okay. In the pituitarism, so that one is just producing excessive saliva, which is normal in pregnant women. Most of the pregnant women produce excessive saliva. Okay, so nocturnal leg pain is common. That is associated with cramp. Pregnant women have cramp. Okay. Then I think generalized abdominal pain is not a good thing. Maybe they are thinking of abruptio placenta. Abdominal pain. No, pregnant women, at least most of us here was pregnant. You don't have, before I was pregnant, when I see pregnant people, I said, oh my God, that would be so heavy. But it's not heavy anything. The only thing is, except if your baby is pushing down. But some people are pregnant, they are dancing, they are wearing their heels, they are doing whatever. It's not heavy. So that sign of abdominal pain, they didn't mention the stage of pregnancy, but I think they may be looking at ectopic pregnancy, they may be looking at abruptio placenta, one of those. It's not good. A multi-gravida female being treated for pregnancy-induced hypertension, which of the following is a sign that treatment is not effective? So the answer is edema of the upper body. It's not a good thing. Pregnancy-induced, so when the edema is getting worse, that is a pregnancy-induced hypertension. And if it's not controlled, that woman may go to what did we say, from pregnancy-induced hypertension to preeclampsia to eclampsia, then to HELEP. So know the sequence. A woman with knock knee. Where do we have knock knee? Valgum. Valgum. Remember? Valgum. We said that valgum, you are checking knock knee. That is a medial genu valgus is also known as valgum. Don't forget that. Valgus is also known as valgum. It's different from varus. So know that valgus, VALGUS, is also known as valgum, VAGUM. So that is your knock knee. That is your medial cololateral ligament. But varus, I keep emphasizing on this question because sometimes when people don't study well, they go to the exam, they see questions like this, and they will tell you nothing is familiar in the test. It's right here. A pregnant woman on SSRI still continuing to have lethargy and depression. What should be checked before increasing the dose? TSH. Okay. Because what are the adverse side effects of SSRI? It's the increased susceptibility, appetite suppression, galacturia, so hyponatremia. Which of the following is an adverse effect of Depo-Provera? Simple. Osteoporosis. So know your Rogan, and the timing. The Rogan, we say that we give it 28 weeks, and 72 hours after delivery. They give it 2 times, 28 weeks before delivery and 72 hours after delivery. And they can ask you, what do we use Rogam for? Rogam helps to prevent rhesus sensitization in rhesus negative mother. Okay. The following method is used to evaluate premature rupture of membrane. Anytime you see premature rupture of membrane, PROM, that is nitrazine test. Premature rupture of membrane. Okay. Know your acute close angle glaucoma. Acute close angle glaucoma. Okay. A welder complained of left eye pain, negative fluorescent uptake. So what do we do? So the first thing is a foreign body in the cornea, and we always do a visual acuity. Please note this word. We have talked about macular degeneration so much, but note that drusen is seen. Where do we see drusen? Please, is in macular degeneration. Please note that word. Put it where you recorded your this thing. Okay. So where can we see drusen? That is seen in macular degenerations. Okay. So what is that drusen? It's just a yellow deposit under the retina. So we see it in macular degeneration. Okay. So what is that? Whenever you see drusen, is it drusen? Drusen, okay? It means that subcentral vision loss could occur in the future. So anytime you see it, it's not a good sign. It shows that something is gonna happen. So look up the diagram. It's a yellow deposit. It's not like the cotton wool. Cotton wool spot is like white, but this one is drusen. 22-year-old male with normal renin test. What would that mean? Air conduction is greater than bone conduction. Placing a turning fork in the skull is a test for what? It's a test for lateralization. So the one when you place it on the forehead, that is a Weber test. Weber. So that is, it checks lateralization. When you place it near your ear, that is bone conduction, that is renin. Patient has nasal congestion for 6 months and patient is using Afrin, that is a rhinitis medicamentosa. A child was diagnosed by another provider with mild conjunctivitis and was given ciprofloxacin. Patient now have purulent discharge of the right eye. What do you do? Just culture the drainage. A child has otitis media. We remember our treatment for otitis media. A, AA, AS, amoxicillin, augmentin, azithromycin. So they say the patient is allergic to penicillin. If they're allergic to penicillin, they're allergic to cephalosporin, they're allergic to sulfur. So what with reaction to erythromycin, so what will you give? So they're allergic to penicillin, you cannot give penicillin. They're allergic to, if they're allergic to penicillin, of course they're allergic to cephalosporin. So the answer is azithromycin. Okay. So they have reaction with erythromycin. You can change the class of erythromycin and give another macrolide. Patient is allergic to macrolide. What will you not give? So this is for you to know the class of medication. What class of medication is macrolide? Azithromycin. Fundoscopy exam showed narrowing on area crossing the vein, that is the AV nicking, that is hypertension, AV nicking. Red painful eye, patient is seeing halos, cannot see peripheral. The buzzword is painful, painful. If it's painless, then that is chronic glaucoma, which is open angle. But it's painful, then that is closure. Close the door, send the person to ER. Fundoscopy exam, you have papilloedema, you have increased intraocular pressure. You also monitor for tumor and also for hypertension. Patient is presenting with headache and elevated ESR. How will you manage this? Give them steroid. That is your polymyalgia rheumatica. At presenting with obturation of angle of the jaw, okay, obturation at the angle of the jaw. So what do we call that? Obturation at the angle of the jaw. Okay. Okay. So that is they said moms. But you can, is it angle of the jaw? Where do we have angle of the jaw? You can read it up. I think I have seen this thing. I think it's talking about TMJ. But you can read it up. TMJ. That is the temporomandibular joint. TMJ joint. But you can read it to confirm the answer. So the answer I will go with is TMJ. Temporomandibular joint. That is where you have the 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 angle of the jaw, but you can always read it up and confirm if it's right or wrong. So, but I will choose TMJ, tempo mandibular joint. Patient is complaining of dysphagia and sore throat, difficulty swallowing and sore throat. That is stomatitis. But this question, stomatitis, they didn't mention, it's not correct because it didn't mention if it's viral. Okay, it can be viral to stomatitis. They are writing there. Yeah, hopefully it's viral stomatitis, but it's stomatitis. Patient is complaining of eye pain. What is the initial test you do? Visual acuity. Patient has otitis media and allergic to penicillin. We have answered this, azithromycin. A 20-year-old patient have a painful ulcer in the mouth, round reddish border, yellowish at the center. That is aphthous stomatitis. You give magic mouthwash. 86-year-old gentleman with progressive hearing loss. Hearing loss. That will be sensorineural hearing loss. Remember what you cannot see. Red orange reflex is negative on patient with except. So take note of this question, uveitis. So you can read up red orange reflex, where is negative and where is positive. A normal Weber test. Weber is the one you put the turning fork. It's not in the both ear. whether the tuning fork is is perceived, the vibration is perceived in both ear, which means that there is no lateralization. That is what it means. If it's perceived in one ear, then that is abnormal. So they are correct. Patient with pulsating pain on the right eye with severe photosensitivity, irregular pupil and redness around the iris. That is iritis. 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 We have done this already. Expected findings in dry type of macular degeneration. That is presence of drusen. An elderly patient with solitary dry crusted lesion around the lips. What is the most? So this, I'm thinking this is herpes. Herpes, solitary, dry. I'm thinking herpes. If it's herpes, I will give acyclovir. But sometimes uh, the English may mean different thing. So this English I'm seeing there is saying lesion. So I have corrected myself. I'm looking at something, it says lesion. Anytime I hear about lesion, I don't think it's a good thing. I don't think it's a good thing. So I will go with biopsy. But if it's just like a bump or a blister, I will think about herpes. So these are the ways you can arrive at your answer. But for the fact it says solitary dry crusted lesion. So and we may be any of these maybe remember we said it's on a sun exposed area. So I would think more of something cancerous. Hopefully it's not squamous cell carcinoma, but anything, because he said dry crusted. So I will do biopsy. But if it's just normal, so I was thinking about acyclovir for herpes, but I also look at it again and I saw lesion. So lesion is different from blister. Patients have itchy, dry eye, cough. So whenever you hear itchy, so that will be your allergic. Allergic. Test to differentiate non-persistent versus persistent strabismus. That is cover and uncover test. What is truth about presbycusis? Abrupt hearing loss, a loss of high frequency. Yes. Then this is another question about 28-year-old male nurse of Hispanic descent. Patient reports history of cold that resolved 2 weeks ago, except for dry cough and pain on the right cheeks. It's worsened by the buzzword again. Bend it down. Bend down. That is rhinosinusitis. You see this Muchihan syndrome again. Muchihan syndrome. Okay.